So Anna was saying she enjoys, and if I get this wrong, I'm paraphrasing, my dear, when the community, healthcare providers in general, I think, are out in the community and at events and offering things that are outside the typical range of services when they're doing engagement, and maybe also when they offer services that are outside traditional hours. Is that what I'm hearing? Okay. Did I really get it right? Okay. Yes, my dear.
As a parent of a child with special needs, I heard a lot of the healthcare providers talk about services being brought to the county, which I think is amazing as far as specialty care, but I would like to see pediatric specialty care here. Every 5 weeks I'm trucking to UCSF with my son, and I know that I have the resources available to do that, but there's a lot of parents in this community that don't have those resources, and I feel that that's something we need to focus on.
Thank you.
Our panelists can respond to
Yes.
any of the questions. So,
thank you very much for your question. I'd like to respond to the lady in front about Restoration House. One of the things that we did there is we actually tried to get our residents, once they're healing and in that transitional process, we actually find jobs for them. Hope Harbor was something, because we have such short time, where we had several of our residents actually serving in the warming center in Lakeport, which was very beneficial for them. And they also are going out into the community and finding work, which helps them, to better transition, better heal. So thank you very much for your question.
do either hospital want to address the question about pediatric specialty care?
So I know that actually Lakeview Clinic is here in the room as well, and I'd like to acknowledge they've recently brought a new pediatrician to town who we've been working to help support as well, and been trying to partner with on that. So there are pediatricians coming to town. I'm actually I'll be going tomorrow. One of the difficulties with some of the specialty care, right, is A, attracting and recruiting the specialists, and then B, having a sizable enough volume for some of the subspecialty stuff to be able to support a subspecialist. One of the things we'd like to do to solve some of those problems is increase the use of telehealth. I believe that that's what we'll be seeing more and more of in the future, especially in rural communities like this, to be able to provide access to this subspecialty care, at least to a greater degree, in communities that may not have the population base to support that in and of itself. And I'll be going tomorrow in front of the state legislature to testify in support of a new assembly bill that's being proposed, AB 744, to support more robust payment models for telehealth, which will help make it much more accessible for our communities. So I think that working with our state legislators and working with government officials, I think we'll see much more of that in the future. I say that as a parent of a son. My son, when he was like a year and a half old, had a gastrointestinal issue, and we had to do the same thing. We had to drive down to San Francisco for visits that could have happened via a video. I mean, there's nothing special. I understand maybe having to go down for a procedure, but for some of the routine visits, there's no reason that couldn't have happened via telehealth. And I think that that's going to be a big part of our solution in the future as well.
Thank you, Dan.
I would just, I don't know, this may be way in the future, but trauma center. Because trauma, people are flown out. They don't have reach. You get billed for that lovely $60,000 bill. So I don't know how much in the future that is, but a trauma center would be something that I would love to see happen in our county. For car accident, I mean, we have trauma in our county, I know that. But thank you.
Any comments from our panel about a trauma center?
Yeah, I'll say, sorry, I can't see you back there, but so at Sutter Lakeside, we are a level 4 trauma center. Unfortunately, that does not allow us a broad range of trauma activations, but we have done a lot. It costs us a lot of money to do that, to be designated as a trauma center. It's a very laborious process, and there are a lot of requirements that go with that, which we cannot utilize very frequently, because again, as a level 4 trauma center, that doesn't enable us to do a lot of the really common heavy traumas. But we do that because we find so much value in the training that's associated with that requirement. We find that it helps our staff be much better prepared for the things that do come in, because inevitably We do have to, as a rural location, we do have to occasionally deal with stuff that you'd be much better equipped at a huge teaching hospital somewhere, but just the nature of the situation is someone may not make it that far, and we have to do what we can. And so we find a lot of value in even just being a level 4 trauma center, in the training that gives to our staff and the preparedness that gives them. Having said that, we do continue to look at the requirements to increase the certification levels. They are very difficult. It's very onerous just to be a level 4 trauma center, but we do continuously assess, and we'll continue to reassess. Maybe could we move up to level 3 at some point in the future. I can't promise you that, I'm sorry, but we do look at that because it's a service we'd love to be able to provide for our community if we can at some point.
Are there any plans to build an acute care facility in our county?
An acute care hospital?
Are you talking about an urgent care facility? An urgent care.
Oh, an urgent care. Thank you. We don't at this time. It's very expensive for a hospital to build something like that out. Not that I'm saying we won't, but it would require probably $5 or $6 million at least to do that. Having said that, that's not off the table. That's something we continue to look at as well. In the meantime, what we've done within our own clinics, for example, at Sutter Lakeside, is we recognize, not everyone wants to go to the emergency room for everything. We want to have an alternative, and so we've implemented an advanced access program in our clinics where we reserve patient appointment slots ahead of time or up until the date of service, and we don't open them up in advance because we reserve them for urgent patient appointments, so that if a patient calls in the morning, and this is for our established patients, but if a patient calls in the morning and has an urgent need and doesn't necessarily feel they need to go to the emergency room, we can get them in that same day to be able to see them in a more cost-effective manner. So we've tried to kind of create a proxy for an urgent care center because we don't have an actual urgent care center there right now.
I just want to thank Mr. Peterson for that. Yeah, absolutely, we're looking at that. One of the things that we are really interested in doing is to be able to provide those services that will keep our families, our residents here in Lake County by the services we're able to provide. Again, an orthopedic, cardiac, all these different things that we could really use. Again, the problem I think that we find is being a small community, 64,000 people, it's difficult. It's difficult to get the funding for those programs. But a great question, and yes, we are keeping an eye on that. One of the things that have come up is the access to clinics, the access to medical care for preventative medicine instead of showing up at the EDs when you're in crisis. And we're trying to open that up at Adventist Health as well to be more accessible. Finding providers, as Mr. Peterson pointed out, is difficult. It's difficult to recruit, attract, and then retain those providers, such as pediatrics and those. But we're doing our best. Thank you.
So we've talked a little bit, but we'll ask the question, what do you like about the healthcare system in Lake County? What's working? Some people have given awesome endorsements of various things. Urgent care last week. Fun times. Yes, sir.
By the way, my personal is weight. I said my personal goal is to lose some weight, but the biggest percentage is 40% of socioeconomic factors. What programs can you address that portion of? Because I think the economic well-being translated to health well-being. So can you address that?
Well, Adventist Health has about 600 employees, both in Clear Lake and around the county. Obviously, those are dollars that are paid to staff and being spent in our communities, so that addresses part of this. We're also renting buildings here in the community, money going back in. And over the past 2 years, we've contributed over $3 million as we are a nonprofit back into the community. And we're hopeful in the next 3 to 5 years to contribute the same.
Yeah, I'd also say, Adventist and Sutter are two of the largest employers in the county. So many of if you look at the cast of characters we have out here, it comprises a large portion of the employment opportunities in the county. And we pay very well as well. I know healthcare jobs are stable. and they pay quite well. There's certainly a big boost to the counties. During the Mendocino Complex fire last year, Sutter Lakeside was evacuated for 2 weeks. We paid every single employee who was scheduled to work during that time, regardless of where they were, what they were doing. We paid $500,000 in just financial assistance on top of keeping their paychecks intact, which was over $1 million for us, by the way. But we paid $500,000 as well in financial assistance to people to help repair properties, things like that. So not only do we provide a very stable base for employment base to support the socioeconomic status of the community, but we continue to do that even during the fires last year when we had no revenue to offset that whatsoever. But thank you. But we also, we spend a lot on contract services. We just opened a $4 million clinic. We're building a $5 million pharmacy. We have many, and I think most of the other agencies around the table would say the same thing. We're investing millions and millions of dollars into improvements in the economy, as well as just donations, uncompensated care, things like that. And we support a number of, even as we've talked about a number of programs here today, I thought, we donated to that, we donated to that, we donated to that, and go on roads or not. Aside from that, I don't know. I personally, I feel that helping us improve the economy in the county is, you saw the numbers, 40%. It is a fantastic way to help shape this. I don't know, I don't have like a magic pill for that or something, but we're trying. I personally volunteer on the Lakeport Economic Development Advisory Committee. I spend my own time doing things like that to try and help however we can to bolster the economies that we live in.
I just also want to address, I can't even imagine what it was like, as I'm new to the healthcare system, for Mr. Peterson to shut down that hospital and then have to go through that incredible startup process of getting all the certifications and inspections and everything that were done. Also wanted to mention that we've recruited healthcare providers, nurses, and other staff from the Paradise area when the fire devastated Feather River and that hospital there to bring people into Lake County. We had to prepare the hospital for evacuation. We began the evacuation for both the Clayton fire and I believe the Rocky fire. Thankfully, that wasn't prolonged, so we didn't have to go through that. But I'll tell you, it is one heck of a process. And kudos to Sutter Health and Mr. Peterson for what they went through. Great job.
Does the supervisors want to say anything about what the county is doing economically? I'm putting you on the spot.
Can you repeat that?
If you want to comment on what the county is doing economically to improve our socioeconomics in the county standpoint.
I'm going to look at Supervisor Scott. I'm going to be honest with you, I don't think there's a specific thing that we are doing to boost the amount of access to jobs other than we want to be inviting to businesses. We are doing our best to create the platform for success. I know that I'm going to be having a conversation with you. Well, it's a small opportunity to create a handful of jobs. Our goal is to make it as easy as possible for people to come into this community, build businesses. I'm working right now on a business incubator venture. I believe that being an entrepreneur in this area is one of the best ways to find success. We have a lot of vacuums in our economy where we can fill those voids. And so those are some of the things that I know that I'm working on. Overall, the health of the county is being worked on to increase and boost the ability of our own staff to be able to stay in their jobs and be able to live economically in a stable environment here. So we're doing a class income classification, or a classification study to figure out where we are compared to other counties, because we are not the most competitive when it comes to staffing and attracting people and retaining people in and we need to not lose the value of those who have the knowledge of the processes that we have in place already. And we need to be able to attract people to come into our community and recognize that we are wonderful, beautiful, and a community where starting a family is the perfect place to be right here. We want to be more attractive for tourism to come through as well. We're working on all of those things. There's not really one specific thing that we're doing other than we're doing our best to make those who are here feel more comfortable, feel more that there's more provided for them. I'm going to again look at Supervisor Scott. And to be honest and very frank, right now we're trying to fix our own house as well. We need to make sure that if we want to help a larger portion of our county, we need to make sure that we're in a stable environment. And so that's why we're doing our class and comp study.
I have heard of the dozens of programs that you have in place, which are fabulous. I know that there are hundreds of people working to improve the county, hundreds of volunteers I have met over the years. As this gentleman over here said, we are still number 58. That's a reality. And everything that I have heard over the years about the problems that there are, it distills down to funding. I heard about the First Five program the other night from Anna Santana, who talked about the great work that she's doing, but she is touching a fraction of the people that need the help because we don't have the funding. So, and that comes from being in touch with our representatives and our legislators. I'd kind of like to hear from who talks to our legislators about funding. There is a bill that was introduced by Assembly Member Wicks to refund Healthy Start from the state level. We need to advocate for that. And as your pyramid shows and your pie shows, the socioeconomic factors are the things that are really going to make a difference in the long run. Maybe you have a target to get up to number 50 within the next decade or something like that. And so I think that the focus should be on the youth and the kids so that they can, get their education, model appropriate behavior, because these health behaviors that the adults are, exhibiting, we're not going to fix that, and I think we really need to focus on the kids.
To the legislators, I'm certainly talking to them about young children, and I'm finding an incredibly receptive audience right now. The governor's May revised budget is robust, to say the least. It's the most increase we've seen for young children's services. Everything from children's savings accounts to more opportunities for childcare, across the board screenings for those ACEs that I mentioned, incorporating those into Medi-Cal visits, trainings galore for professional service providers, looking at higher reimbursement rates for care providers for young children, increasing quality. They're looking at how all of those things relate to each other and how to create a plan that makes sense. I see a lot of movement around young children in our state budget right now, which is very exciting to me personally. I would love to see us match more of that here locally. And so I'm trying to find ways that are solutions that are attainable. As Supervisor said, they're trying to clean house, and I don't want to get in the way of that, but I also always have ideas for how we can be working on prevention primarily. However, when you talk about moving the dial on the health rankings, that's not going to do it in the short term, but that is the biggest return on investment over the long haul. But if we pour all of our money into young children, we won't see necessarily the health ranking improve in the next 2, 3, 4 years, right? It's investing for the long term. So it's a dicey thing, right? You want to see the results right away, but investing in children takes time, and I think it's worth it.
And we have to remember, it's not a sprint, it's a marathon. What we do today, this year, is going to have an impact 3, 5, 10 years from now.
So Hope Rising facilitated a prioritization session with local agencies on behalf of both hospitals and public health to facilitate what our hospitals do collectively for the next 3 years to identify our priorities for Lake County. And we took a really good look at what our community has said that we need to do, as well as what our health ranking was. And from that, we identified that in order to move the needle on our county health ranking, we really need to address premature death. And there are two heavy weights in premature death, and that's cardiovascular disease and cancer screenings. So one of our priorities that we identified to move collectively together as a community and as both hospitals is to address our cancer screening and prevention. And that will move the mark for our county health ranking. It will also better the lives of our community members. Our community members will live longer. Everyone will benefit from that. We also identified that, hey, we're doing a ton of work. We're beating our heads with doing work with different agencies to try to reach our community, help each other, pouring tons of dollars into access to services, and it doesn't seem like everyone really is aware of what's available to them. So one of our priorities that we identified was community engagement and outreach. Does everyone know where the Great Walking Park is? Does everyone know where they can get their free mammo? Does everyone know where they can get access to 0 to 5 resources and services? So that is one of our priorities, and that's something we're really going to be working on for the next 3 years. So I just thought I'd let you guys know that. Thank you.
0 to 5, first 5 is just the most fantastic program. I wish we had 6 to 18. And we are really lacking in that school-age health.
To address your point, Bonnie, we can have it there. Dr. Cooper pointed that out. We have a clinic at the high school, and yet he's still seeing a student athlete with an abscess. It's right there. I don't know. How do you get that young man to go to the clinic? He had to be in pain. So it is outreach, Allison. Thank you very much for bringing that out and maybe making it maybe a little more comfortable, maybe a little more inviting to them. But we do need to provide access to care that they feel comfortable going to. And I think we are working hard to do that.
Well, first of all, I have to confess, I work for Sutter Lakeside. I've been a long-time employee there, 25 years. I absolutely love it. I think we do great care. I love the fact that our hospital is associated with California Pacific Medical Center. So if you have a problem and you need an answer and we don't have it here, they have it online, have the ability to get it. Our radiology services, our radiologist is awesome, but if you're thinking about something or he doesn't like the way something, he gets on the phone and he goes, "Hey, George, can you look at this case with me, please?" And they get on it together and they take a look and they figure out what's going on. Same thing, they now have mental health patients via an electronic, which isn't perfect, but we don't have psychiatrists or psychologists wandering the county here very often. So it's one answer that I feel like has made big strides. A lot of folks, particularly young people, aren't necessarily very comfortable talking face-to-face with a provider they don't know or don't trust. But it's interesting when you put them behind a screen, put them in front of video, they'll answer up. And the fact that the doctor, the provider can see the patient then helps actually assess, because it's not the same as because many of those people who have health issues are very good at putting up very good fronts. And a good psychiatrist, a good psychologist will see if they can see the patients. ICU has an e-cart, so if there's somebody's, you've got to crash. I mean, we have people here in the county that know what to do and how to help, but we have that are specialists. That's all that they do. Online, available 24/7. So what needs improvement? I would say more access for more people, but the healthcare system that we have in this county is awesome.
I was just going to put a plug in for Sutter from a patient's point of view, because I feel that the positiveness of the people that I talk to, from the receptionist to the radiologist, amazing. Everybody's kind, empathetic. So, yes.
I agree that the health system is very good for adults, but when it comes to children's pediatric services, specialties, we are lacking big time. And unfortunately, many of families who have sick children are very impoverished and have a difficult time getting into the city. Now, I understand Partnership does transportation now, but the difference is you have to go to a city where you don't live, and it's if you have one appointment today and then an appointment on Wednesday, on Friday, and then another appointment on Monday for different things, it's hard for those families. If either one of these hospitals, if both of you guys could collaborate and talk to UCSF, to Oakland Children's Hospital, to Stanford, and even if we get a specialist one time to come into where all of our providers, people there on that one, would make very much sense, and it would help a lot of families. We have satellite clinic in Santa Rosa. They don't have all the that come, but I think the more we are a squeaky wheel, the more maybe we'll get more specialty and closer.
I think, first of all, I have to give Anna Santana, this is now my Lake County Office of Ed hat. She runs the Healthy Start program, and I hope all of you know that. So at least in the oral health part of it, with the children, they transport the children to the clinic. We keep a block of time open. I think Lakeview does that also, where the children they come right from the schools right there. The other thing I want to brag about is we have the first oral maxillofacial surgeon in the entire Adventist system is now in Clear Lake. And with public health, we've worked on the physically handicapped. He's brought them into the hospital to get them done. They were waiting years to go to San Francisco to get their stuff done. They're being done right here. He's getting referrals from Eureka. They're coming down here. So at the Clear Lake, it's become a destination, a hospital for oral health. And then also, one thing I didn't mention is Wendy Gattoni, who's through public health. We used to have a tooth fairy. We called her Marta Fuller, we called her the tooth fairy. She ran all of oral health throughout the entire county. And then with the lack of funds, you got rid of her. Well, we had now. She retired, you got rid of her. Now we have Wendy Gattoni, who has brought this whole program back up. We used to have not only the goals, mission stuff, we had the data that proved that what we were doing with the children was working. And now we hope to reestablish all of that again. So again, thank you to Public Health and to Anna.
Again, I'm with Partnership Health Plan. I very much appreciate the comments about pediatric health care. We have a new governor, and one of the major areas of emphasis with the new governor and the new California State Surgeon General is indeed pediatric care. They've looked at the care. They found it in terms of the entire state. They feel that it is substandard. So they're shining a light on it and putting a lot of emphasis on it. And when the governor does that, so do we. And so we are looking at improving pediatric care and services. To that end, it is extraordinarily difficult to bring a pediatric specialist. First of all, there are a couple dozen of them. So if you bring up a pediatric orthopedic surgeon, it doesn't help the pediatric patient with an endocrinology problem. So bringing specialists up here, because they are already completely full where they are, is very difficult to do in an economic fashion for those health centers, for the UCSFs, the Cal Pacifics, and the UC Davis. We are, however, in some discussions because Partnership does support telehealth, video telehealth, and other forms of distance communication. We are currently talking to both UCSF and UC Davis. And these discussions always in the details where it gets difficult for pediatric telehealth, pediatric subspecialty telehealth possibilities. In most of our health centers, certainly Lakeview, our Adventist friends and others, have that capability to have telehealth visits. It's a bit off in the future. We certainly hope that it'll come to fruition, that we'll be able to bring pediatric specialty access through telehealth visits.
I can give you a personal example about that if you'd like. And I would echo what Dr. Kubota is saying. There's a difference between primary care and specialty care. I feel like we're making some good strides in terms of primary care. So for example, I know Lakeview Clinic, Kim Tangerman over there, has recently hired a new pediatrician in the Lakeview Clinic up here on this side of the lake, and we've helped support a number of these programs as a hospital as well through our call coverage agreements for those pediatricians, with those pediatricians. Pediatric specialists, again, are different for the reasons that he mentioned, but also not just the economics and not just the shortage, but also the competencies, right? So you don't want somebody coming up here and doing surgery once in a blue moon, because maybe even if you could convince that surgeon to come up here and do surgery, the staff are not used to doing that kind of surgery. For the really specialty type things, you kind of want them done in a place where it's done every day, and it's done the people there are very familiar with it. And pediatrics is very different, right? So pediatrics is a specialty in many areas. But I also agree, I feel a lot more can be done with telehealth. My son, when he was about a year old, was diagnosed with a GI issue, and he had to go see a pediatric gastroenterologist. We drove down to the city to do that. It was very frustrating, and I recognize we were fortunate that we could do that, and much of our county can't take a day off of work to go down for one medical. I mean, it takes the entire day, if not more, and just have the resources to do that. But he was diagnosed with this issue. He had to go down and see a pediatric gastroenterologist for a basic introductory visit. There's nothing in that visit that couldn't have happened over the phone or on a video. You're right. But we had to drive down there for it because the telemedicine setup was not in place, because the funding mechanisms for telemedicine are not in place right now. 3 weeks ago, I testified at the State Assembly. Assemblymember Aguiar Curry has put forward a bill to help provide some parity in telemedicine reimbursement to help support communities specifically such as ours. There's a lot of improvements that need to be made to help make that feasible from a bureaucratic and policy standpoint still. But I feel like we're making progress, and I do see a vision that supports a much greater degree of telemedicine for many of these specialties. Now, I don't think that solves the problem, because my son, he didn't need an actual procedure, as it turned out. But had he needed a procedure, the best thing for him still would have been to go down to one of those specialty hospitals in the Bay Area. And so I see telemedicine as a way to mitigate this and to provide a better solution going forward. But I don't know that in a community the size of ours, we'll be able to offer true, pediatric subspecialty services, because there just isn't enough of the population here that needs it to keep people competent in doing that. Does that make sense? That's my worry. Maybe there's a good solution out there that I'm not thinking of. I hope so.
I agree with you, Amanda. The squeaky wheel thing works great. I mean, it isn't immediate, but it's a constant, right? We can identify the needs, we can show the return on investment, that kind of stuff, and at some point, the tides will turn, and then we'll start getting the attention, or it may start with telemedicine, and it may roll into, I don't even know, sky's the limit, but it is the squeaky wheel thing at this point.
How was this opportunity publicized?
Okay, so we did publicize it. In fact, I used KPFZ as one of those opportunities. Dr. Gustafson and I went on and did a whole radio show on it for that population. We went to the Board of Supervisors and got their blessings and buy-in to do it, so it was announced through them. We had multiple press releases out with the dates and times of where they are. It's on our website. It's on the Hope Rising website. It's on Facebook. It's on social media.
So what I feel like where we really went wrong was we should have put in the title, like, we're going to put a Dollar General down your main street. And so next time we've learned our lessons. So thank you.
I only wish there were more.
Right.
You could have used Jean's email list to send out.
Right.
I guess it's just like a miscue.
So it's just like, we need to know more about.
Right. Communication, outreach, engagement. The other thing that we've noticed, this is the third one now, is that a lot of people really didn't understand what community visioning forum was. They thought if it was a town hall that what that was. So, you know, lessons learned. We're going to do them again. We're going to keep doing them. So we'll improve as we go.
The video lives on Facebook, so if someone wasn't here who you think would really have had a lot to say, encourage them to watch the video and then send emails with their questions. When these end, we don't have to end the conversation, so that's one way we can at least include them.
Yeah, so in your packet on the very last page is a contact list, and you can email us, you can call us, whatever you need. If you go home tonight and or tomorrow and you're having lunch and you're talking to people, get on and give us a call and give us that comment, or email us with the question or the comment. This isn't going to end. We're going to keep going on with it. What do you like about the healthcare system in Lake County, and what needs improvement? So I know we had a few comments earlier, but
well, this question should fit right in with that. It's just a nit with Dan Peterson. You're touting the access to Sutter, and we would love to go there, except our medical expense sharing company is not networked with your organization. It is with Adventist, which we really appreciate and we go to all the time, in Ukiah, Clear Lake, and such. But if you could look into why MediShare, an expense sharing service, is not allowed in network at Sutter, I'd really appreciate it. Thank you.
MediShare, did I get that right? Okay, yeah, I'm happy to follow up on it. We have a very broad range of contracts within Sutter, but no health system has a contract with every payer or expense sharing network or any of those. We try and make it as broad as we can. I can't speak to this one in specific. I'm happy to follow up on it. And if you want to talk to me afterwards, we can exchange cards or something as well. But we can't guarantee that we'll contract with everyone out there, and nor can Adventist, nor can any health system. But we do try and contract with as many as we can, and do have quite a broad range of contracts. Yeah.
So what needs improvement?
I would say to safe housing, and safe and affordable housing is a big issue for our residents due to what seems to be some price gouging that has gone on, secondary to families losing their homes in the fires. It seems that affordable housing for families has really decreased the availability in our county. And so I wonder, are there any measures that we could consider implementing to prevent price gouging during a disaster?
So I'll let Supervisor Brown address that, because we do have some.
There's actually state law that prevents it. We implemented that, we reinforced it with ordinances, and we were not, we encouraged people that if you experience price gouging of any type, based on those ordinances, to come forward with it, and not one came forward. So I'm not saying it didn't happen. We didn't hear about it. We encouraged people. We had the district attorney at the time involved with it, and again, all we were doing through ordinance was just enforcing state law. I think city of Clear Lake did it as well during the sulfur fire, and we just basically just reinforced the state law through that, and there were no instances of it that we were made aware of.
How would one go about reporting if one was aware?
To the district attorney's office.
Okay.
Yeah.
And just to kind of, I was also on city council when the sulfur fire rolled through. I was mayor at the time. And one of the things that we saw, it isn't necessarily price gouging, but it's a supply and demand issue. We only have so many local contractors, and there was such a demand for their services. My neighborhood was also devastated by the sulfur fire, which happened the same night as the Santa Rosa and Napa fires 2 years ago. And only one home has been rebuilt, and that's just because there's no contractors to come in and do the work. I think we have about 4 or 5 started now, but that's 2 years after the fact. So it's very expensive.
I did want to add too, because I think you had a 2-part question about we need more housing. We don't develop houses. We're not builders.
There is inventory available for property that's zoned appropriately. So the developers just need to come in and start working. There's several agencies, ArchCHDC, the City of Clear Lake, the City of Lakeport, both have several projects going in. The county is, there's a project going in here in Kelseyville it's in the permit phase. But basically all we can do as policymakers is make it as easy as possible for someone to get through that process. And that's it. We don't develop property, so we have to, we have a housing element in our general plan, and it's updated not as regularly as it should, but as it stands right now, it's still adequate because there's a ton of inventory out there of land that's available, that's zoned appropriately for that, and the infrastructure to support it with water, sewer, and roads. So.
Again, Todd Metcalf, Lake County Behavioral Health Services. As I mentioned earlier, Lake County Behavioral Health Services did take over the administration of the Lake County Housing Continuum of Care, which addresses housing and homelessness. My department is sitting on monies that are available to develop housing, but those housing elements are only available to those folks that we serve, folks with mental illness and or substance abuse problems. So there is hope, there is housing coming, but it's limited to that population. The Lake County Housing Continuum of Care is able to, we're in the process of forming it into a 501c3 so that it can apply for other housing funding and projects, but a lot of them are limited to what the monies are allowed to fund as far as who's qualifies and who's eligible. But we're working on it. There is a project in the works, and I can't share too much about it, but there is something coming. But again, it will only serve those that suffer from mental illness, but it will help address the housing shortage.
I also like to address this. At Adventist Health, we open and operate one of the only homeless transitional housing programs in the county, which is through Restoration House. We're proud to say we've done over 40 clients come through that, and that's respite care primarily for those who are unsheltered, unhoused. But one of the things that we're finding is there's a very low inventory for rental properties. So one of the things that I might reach out to the folks here in the Kelseyville area and also those maybe watching in, we have a real issue with dilapidated housing, with housing with absentee owners. And one of the ways that we're trying to partner, and I want to congratulate NCO, they've helped us in our partnership of trying to get people into permanent supportive housing. But there is just a very low inventory out there for rental properties. And the rental properties, because of our wildland fires and because of that low shortage, many people have been priced out. I think there's a real misunderstanding about what causes homelessness, and I want to just share with everybody it's a very individual thing. It isn't because of drugs or alcohol or things like this. Some of our seniors are actually been priced out of housing. This is their community, this is where their friends and family are, and they're choosing to be homeless or living in cars because this is the only area they know. And so I echo that, and I just really, if you have housing available or if you can convert housing, you should look into that, work with the county, work with the cities.
This is for Lars. I love the Highland Springs Recreation Area. There are lots of great trails up there. And I think more people would use it if it had great maps of the trails.
So I would love to be able to answer that, but unfortunately, the Highland Springs falls under the Department of Water Resources because of the nature of what that area is for. So yeah, I'll refer you to someone that's not here, unfortunately, but I can tell you that I recognize that the need, and I've talked to David Cowan actually about that, the Director of Water Resources, and I shouldn't speak for him, but I'm fairly certain that is something that is on his plate already.
Can someone explain how we as a county are helping residents to be greater prepared in the event of an evacuation for wildfire? For that preparedness for individual families or seniors with special needs, does our county have a way that we're planning to address that to make sure that we're
Yeah, Supervisor Brown answer that.
Well, I don't know if you're going to like the answer I give, because I'm putting this off, there's some personal responsibility too, because every fire is different. There's no way you can have a plan right now that says, if there's a fire in your area, evacuate this way. Because, as all of us know by now, when there's a fire, it's chaotic. There's smoke everywhere. You don't know even where the flames are coming from. You just know that there's a fire. And sometimes we have a little bit of notice, but in a lot of cases, the sulfur fire is a good example of that. The Valley Fire, people were leaving, and they were getting down to an intersection. The husband went to the right, the wife went to the left, and then and so people get separated. You have to identify and get ready on your own. Where are you going to go in the event of a fire in your area? There's no way that the sheriff's office or OES can ever determine, even the sirens, which, they provide some level of comfort. If a siren goes off, what are you going to do? It's basically telling you there's a fire and you already know it. So you really have to kind of identify that on your own. Now, I know there's a lot of seniors out there that really rely upon it. It is up to the community to identify who these people are, have somebody there, have this friendly neighbor, or whatever that program was that you talked about. Have somebody that can come pick you up and help you. Have your meds ready. Have a go bag, whatever they call that, But it really is a personal responsibility type thing that if there's an evacuation, the sheriff's department, fire department, which is usually law enforcement and mutual aid from other counties, they're coming in. They don't know the area, so they're not going to be able to tell you go left, go right. They're coming through and telling you get out. Get out as quick as you can. And so you have to know in advance, if there's a fire at any given time, which way do I go? Give me my options. And that's really what it boils down to.
Would you say that it would be extremely important for each family to develop a plan, a written plan and a contingency plan, as important as having a back?
I think so. I mean, I don't know how, if you want to have it written out, because I don't know who's going to sit around and read it. You're going to get in your car and get out of there. But I think you need to have a plan. I mean, we do, most of us do, but not everybody does, because I think we've become so reliant upon, well, somebody needs to tell me what's going on. And I joked about it earlier about, getting a call from the sheriff's department. People, they hear that flood warning and they're thinking, oh my God, what's going on? Well, it rained a little bit, but that was a warning that came from San Francisco or Sacramento. During the fires, this last fire, somebody in Sacramento reading a map said, oh, this fire is here, Kelseyville's here, we need to evacuate Kelseyville. They didn't take into consideration that there's 7 miles of vineyard between us. There's no fire hazard in Kelseyville. So you got people out here scrambling out here. I was out here directing traffic for hours trying to get people out here. And I was telling them, go back to your home, that's where you're the safest. So, everybody has to determine exactly what it is if something happens in your area. If you live in the Rivieras, right now, with the fuel load out there, there's a good possibility there's going to be a fire. Better come up with a plan. If you're living out Kelsey Creek, everybody knows whether or not they're at risk somehow or another, and they need to come up with a plan and work with your neighbors. That's the only thing I can tell you, because I don't think you can rely upon, and I don't mean this in a bad way, they've got other things to do. Sheriff's Department, Fire Department, they got other things to do than to show you the exact way to get out and how to get out of the county or how to get out, wherever you're going to go. It's up to you to decide that, to determine that well in advance. So that's what my suggestion would be.
Another thing I want to add as a department head, because I have some of my peers up here, my department, Behavioral Services, does have a system in place. So when a disaster happens, we notify those that we see are in an impacted area. And I worked in social services, we did the same thing. But the criticism comes, well, so I have to be responsible for everyone in this county that has a substance use and a mental illness problem? No. We can only notify those people that are in our system. And so I know the other department heads do the same thing. And Crystal, I don't know if you want to speak to this, but because I've gotten this before. I've lived in this county for 7 years. I've been through all these fires, and people come to me and say, well, why didn't you reach out to everyone? But we can only reach out to those that are in our system. So that's the best we can do. When it comes to disaster, as Rob said, all bets are off. I mean, everyone is different. Yeah, we've been through fires, but every single one has been very different. So we do the best we can with those that we know are in our database, and the rest, like Rob said, we got to figure it out on our own.
I'll pipe in too. So I think the original question that you asked was about senior and disabled and how do we help, get them out. And so the department does operate in-home supportive services. And while that doesn't cover all seniors or disabled people, we do have a caseload over 2,000 in Lake County. And what we do, and again, it does require that they be in our system, but we do call those people who we believe to be medically fragile and in an area that would be impacted by a fire. So we do a call down, which is not really efficient, but we've done that for years now. And so what we're working on right now is a process to match the addresses with the GIS in the county so that we can focus in on who really lives in that area right away and get information out. So it will be more efficient, but again, it does require that they're already in the database.
Just really quick to cap on a couple of things that Supervisor Brown mentioned. If you don't have a Nixle on your phone, I highly recommend you get that. Sometimes it can be annoying if they're going to tell you that it's going to rain, but it's also going to tell you if we've got a fire alert. Prepare for that 72 hours that you might be evacuated or have to shelter in place where you may not have water or power or things like that, so you want to have those reserves. I want to also provide kudos for our Lake County Transit. During some of the fires, they went into very hazardous areas and evacuated seniors and people who had serious medical needs. They did a fantastic job of doing that. And last, through the American Red Cross, we have a resiliency grant that was provided, and we're trying to work with a lot of our people that are in the communities, because when they smell smoke, when they see evidences of fire, they're really stressed right now. So if you're interested, you can get a hold of Melissa Greeby. She's our American Red Cross resiliency trainer, and we're trying to do community trainings in how to be resilient, how to overcome these stresses that we've had in the last few years because of fire. Thank you.
So in addition to that, I'm going to weigh in just a little bit. So if you go to the American Red Cross website, or if you go to CAL FIRE's website, they have the list of the go bag, what you should have in a bag ready to go. The other thing that you can do is if you have a disability or someone who's frail or fragile or senior, they can also sign up on the PG&E website to be notified. You don't have to tell them everything that's wrong with you, but you can list there, because I have a disabled husband, so I signed him up because if I'm out working and we get a notice, he needs to know. So you can do that. You can get on Nixle. You can get on the other county one. It's, Dean, help me out, the Lakeco Alerts. So sign up so that you're with the right information. A lot of times people refer to what's going out on social media to get their information, but you want the right information. Where is it really at and where you need to be evacuated. I can tell you, like Russ had said, minimum 3 days. The Mendocino Complex fire, people were evacuated for 7 days. So grab your meds. Make sure that you have a week's worth of medications with you. Make sure you have cash. People do not think about that. Okay. Get some cash. Put it in your bag. Know where it's at. Water. Food that you can readily eat. Things that are pre-made beef jerky, granola bars, protein bars, the fruit, the dried fruit and stuff. Stuff that'll stay, that you could have all summer long in a bag. And if at the end of the summer, the end of fire season, you don't need it, put it back in your cupboard and use it later, okay? But you have to be prepared. You have to be ready. I have a go bag at my house, and I have one in each of my vehicles. Because when I get a call, I've got to go. And so I want to make sure that my family has what they need, because I'm going to be working while they're evacuated.
Okay, well, when you say have a week's worth of meds or have whatever, I'm a healthcare provider, insurances don't allow you to get your meds and have stuff. I mean, if anybody knows how to fix that problem, but I just know we're evacuated. I was getting calls from pharmacies all wherever they had gone to try to get, because they left, they don't have extra meds to have in their bag. You don't get to do that. You don't get to say, okay, you get 30 pills, you got that pill once a day for your blood pressure, and by gum, you get 30 for your month, and there you go. Well, you can't have them in your go bag.
So this is what I did for my husband, who has a pharmacy in our house. Yes, they're 30 days, but you can call in your medication on day 28 and get it filled. So he took one pill over the course of several times and got a week's worth stored up over the course of several months. He still took all his meds every single day, but sometimes you have to think of how you can do this. So that is one way that you can do it, and I'm sure the partnership up here is not going to like that, and he's going to get mad at me, but I don't care. I've got a very disabled.
An answer that's great.
Yeah,
I'm just saying.
cardiac husband. So we have a week's worth of meds set up in our go bag, ready to go. He also has a list of all of his prescriptions, because when there is a disaster, the pharmacies will fill 5 days worth of medications. And if we have problems with that, we call the EOC, and our health officer takes care of it.
2-minute warning.
Thank you, Russ. I appreciate that. So I'm going to let Dr. Kubota talk now.
So during the fires, all the way from Jerusalem to the Kent fires, including the Tubbs Valley, Mendel County, most of these are in our counties. Partnership, well, first of all, we met every morning during these fires. Our administrative, we have a special team that meets. But we open up our pharmacies for emergency refills, plain and simple. We also open up where they can go for their health care if they need to. They can go anywhere, and we will pay for their health care. So if they need medication refills, of course it's best if there's some record of it, like CVS, their system is nationwide. And so it's best if they have that. It's best of course, if they can get through to their healthcare people, but we do refills, and we also allowed, like, people were stuck in Napa County during the Valley Fire, even though they were from Middletown. We allowed them to see any healthcare provider in Napa Valley. We allowed them to get their refills. So we do respond to those types of acute needs. Now, other health plans may not do that, and Medicare may not do that, but Partnership certainly did that. And I agree. I have my go bag in the back of my car. It's out there right now. I have one out in our yard as well, because you'll want it in the house if you're running out of the house. So you have to think, if I have an hour, if I have 30 minutes, if, like me, we had 7 minutes from the banging on the door till we closed the door for last time.
I could talk about the fire thing from a variety of perspectives. My wife and I lost a home in the Valley Fire in Cobb, so that was an interesting experience. 2 years later, we wound up in Calistoga, where we now live, and the Tubbs Fire happened just a mile away from where we lived. I last summer drove a bus for 3 days doing evacuations. And just a couple of really quick things. One thing is, there were a lot of cracks that we saw. But one of the things I saw, especially last summer, was how well people handled the challenge of the evacuation. I mean, it was a pretty calm, orderly thing that was going on. From what I was able to see, and an amazing response from law enforcement working together with the transit to get people who needed help and so forth. It was pretty impressive. So I think we're learning as we go along. I really do. The other thing that I want to say is, in terms of disaster preparedness, both at an individual level and at a community level, sort of picking up on what Supervisor Brown mentioned. If you want to see, I think, I don't know if it would be correct to say a model of what a community can do to take responsibility for itself, but I think that's pretty good way to describe it. Go up to Cobb, learn about what they're doing in the Cobb Area Council, the developing a Firewise community. Anderson Springs now has adopted that plan, and I think some other communities around the lake are beginning to pick up on that and really promote individual and community responsibility in recognition of the fact, as Supervisor Brown said, that stuff is going to happen. We kind of know, we've learned a lot about the dynamics of the situation. So what can we do proactively to be prepared, not just individually, but as communities. So I'd highly recommend, if you're interested in pursuing that, to get in touch with the Cobb Area Council. They have a website. They have a meeting third Thursday of the month, and you can get connected with some people who've really been working in this at a deep level.
Get out, right? 5 minutes till it's 400 degrees at this height.
So I just want to add this Hope Rising's Innovation Summit that's being held on June 14th in Clear Lake is focused on building resiliency and access to services for our homeless population. And a big portion of that summit is really about how do we build resiliency within ourselves, within our organizations, and within our community. And it's really addressing burnout because of recent fires. How are we, we're coming into summer, like we all have these stressors now built into us because of the past 7 years of fires. Like we can all feel it, and we can't, like you said, avoid what's in the room. Like, how are we addressing that? So we'll be talking about that there that day. We'll have 150 disaster kits to give out to each attendee who's participating in our Innovation Summit. So if you'd like to attend, you can register online. Also, I did work with American Red Cross a little bit over a year ago. We handed out 600 disaster kits for every single classroom, almost every classroom in our schools. So every classroom has a disaster kit. So if they were stuck in their classroom, they'd have food, water, some of the essentials that they need. And I'm really grateful for American Red Cross for being able to provide that service to us. And I'm glad that our classrooms have those necessary tools. So I just want to add that.
Yeah, in addition to the fires, we've all been pre-warned that PG&E is going to be shutting down electricity over the course of the summer. So right there, that's your first warning to get ready, have something prepared, have a go bag ready. We also have it on our public health website where you can get that information as well on our emergency preparedness page. But yeah, I would be ready right now. And when it kicks, when you're told to get out, it's too late. You don't have time.
Put your photos in the cloud.
Yeah, put all your photos in the cloud. I'm personally working on that really hard.